So this exercise is not only the exercise, it's the same time checking your every joint, finger joint, wrist joint, and the shoulder joint. Okay, hope you have a lot of energy. Go to the next o'clock. Thank you.
Okay, everybody have a seat. Okay, there's an announcement. We do have a nurse station outside, okay? If you need help, some kind of discomfort or upset stomach, maybe. We do have a lot of doctors here. But it doesn't mean doctors' health is better than everybody else. Okay, so we go on the next session.
Welcome back. I hope you had a wonderful break and had a chance to refresh yourselves. Now I would like to invite Dr. Kit Hui to discuss East-West Integrative Medicine and Global Health. Dr. Hui is the founder and director of the University of California, Los Angeles Center for East-West Medicine at the Department of Medicine of the David Geffen School of Medicine. He has blended traditional Chinese medicine and modern Western medicine to create an innovative healthcare model that is patient-centered, focuses on health promotion, disease prevention, and treatment. Please help me welcome Dr. Kit Hui.
Good morning. First of all, I'd like to thank Dr. K to give me a chance to come to join you all at this city of Fresno, and I, would like to say that I was here to share, but I learned so much already before I get even started, and I really truly think that the silent, mentor program is just an amazing program, and I think Dr. Lee has spiritual longevity. He will continue to guide us in our future years in our life. So I have been at UCLA almost 50 years, and my dream at that time when after graduate from chemistry at UCLA, I attended the medical school, and my interest at that time said, well, let me see what I can learn from what UCLA can offer me in terms of learning how the West approach health and disease. At the same time, try to see what I can also learn from what China for several thousand years has helped the Chinese civilizations to grow, over the millennium. So how can you as a young medical student get this dream realized? And I would say without a lot of luck, a lot of help by many people, it would not have been able to give me the chance to come to share with you what I hope may be a good healthcare model that would allow us to address the healthcare crisis, not only at the personal level when we have problems that no one knows what else to do to help, but at the same time to see how all the countries that are now facing the healthcare crisis because it's financial unsustainability. So let me start out with just a patient. As a physician, we always start teaching with a patient who come to us to ask for help. So a lot of the approaches would be discussed a little bit more in detail in the afternoon. A little bit louder? Okay. So let me just talk about this patient's story. this is a very common scenario in primary care. And whether you're a physician, a health professional of different types, and also potential patients, many of us would have heartburn, have headaches, have insomnia, and so on and so forth. So they come to us, and so this is one such patient who came to us. And I just want people to kind of recognize that the reason why we become sick is because the body is unable to handle the stress, different type of stress that we have to handle. So let's look at this patient. She is middle-aged. She's divorced. She overweight, and also has pre-hypertensive type of blood pressure readings. She's a nurse, and I have a lot of respect for the nurses. They basically have a tough job between patients and the doctors and the family. A lot of physical and emotional strain on them. And that she come to us with heartburn. But most importantly, it's very important that people come to you with one symptoms, but they have many, many other problems. Unless you address them at the root, you will not be able to solve the problem. You may be putting a patch on a symptom. So obviously, besides the GI symptoms, of course, she took some medications. She also have headaches, a migraine, and allergies. I mean, obviously, taking an NSAID is not going to be any good for someone with gastroesophageal reflux. So we usually at UCLA, which really in our clinic is the last resort for UCLA. We have more than 500 physicians of different specialties who will refer to us. And so we have to use a whole different approach to figure out how to solve a problem. So these patients may be sent to us by the GI specialist or the pain specialist or so on and so forth. So with this patient, obviously, we do a very detailed history, and obviously we need to try to understand what medications they are on, what supplements they are on. Oftentimes they take too many supplements that should not be used. And at the same time, we look at their diet. What do they eat? It's not the average good diet, but a diet that would fit with their constitution. This is what we'll talk about later on in the afternoon. So we also try to look at what type of exercise do they do. Because oftentimes a lot of patients, they come in, they have a lot of headaches, neck pain, and all kind of problems, but they're doing the wrong kind of exercise. Without the right exercise, which again can be also damaging. So and then in terms of the medical history, I mean, I don't want to read all the problems that she actually has. She has surgeries before, so anywhere she gets surgery, we also know. And how. So in a sense, a detailed medical history is very, very important. So in terms of the stresses from our perspective, okay, it's not just psychosocial stress, which I think is obviously very, very important. And psychosocial stress can be just part of their work, their job, the family, kids going away, or sick parents, or single parent, and so on and so forth. But realistically, when someone have a chronic problem, that means that their body is unable to withstand these stresses, which could be the wrong food, could be changing temperatures, and it could also be kind of the wrong kind of mechanical load on the body. So we kind of look at what type of food that they eat, and obviously, oftentimes a lot of average, good diet may not be the best diet for that patient. So just to very briefly talk about our clinical approach is to try to understand how the patients handle stress. And in our clinic, besides standard Western medicine, because all our doctors are dual trained. We are doctors who are trained in mainly in internal medicine. We have one family medicine, the geriatricians. And we already know what Western medicine can do or cannot do. So we add on to what other healing traditions can do. And in this particular clinic or model that we have is that we incorporate Chinese medicine, which include the medicine that look at the whole system, that look at factors that may affect the body's ability to handle stress. And we use acupuncture-like stimulation. And obviously, we'll talk about trigger point injections, because trigger point injections is actually a Western model of stimulating the body, particular areas that cause for the patient's pain or other non-pain symptoms. And we also will teach people how to eat, how to exercise, how to get a good sound sleep, so that the body would be able to withstand the stressors that get them out of balance. And our balance in different systems give you different types of symptoms and different label of diseases. So that's basically our clinical model. And with this model, which I kind of try to develop in my mind, because I'm trained in internal medicine, I'm trained in clinical pharmacology, I'm trained in geriatrics, and I've done research in 10 different types of diseases. So I first have to integrate Western medicine. At the same time, I have to try to understand Chinese medicine, that they are trying to integrate, both in mainland China and also in Taiwan and other, I would say, countries as well. So I basically try to see, well, what else can we do that we can safely incorporate into a place like UCLA to allow us to have a model that is legally defensible, but because UCLA is self-sustaining in the health system, we have to figure out how it could be financially viable, but it's also to be socially acceptable so that we won't get people to shut us down. Because when I started this program in 1993, December, so it will be 25th year anniversary for our center, we really need to make sure that besides being clinically useful and scientifically sound, we will not be able we will not be shut down. I just want to be sure that we have a clinical model that actually works, and at the same time will allow us to teach, our future generation of physicians. So for, I would say, 21 years, we've been teaching our medical students at UCLA, first year, fourth year medical students, and also residents, and then we have a 2-year fellowship. So obviously the outcome is actually quite good. We cannot solve all the problems. We can add value to most of our patients who get referred to us, because everyone's going to have stress. Everyone do not have good sleep. Some of them have fatigue and their pain, their emotional problems. But if you use the model of caring for the patient and trying to show that we work as a team, we teach them what I think they ought to be doing and what they should avoid, and then we judiciously use our treatment approaches, and we teach them what to do at home. So it's not advancing. So one of the reasons why I am trying to take my work outside the ivory tower of UCLA is because I see that, I would say since the 1990s, I see that the current biomedical model is not sustaining. And so I've been talking about the healthcare crisis, the need for a new healthcare model. And I wrote papers for WHO and also talk about this in the different type of institutions where I have been invited as a visiting professor, and I advise, consult the governments like Hong Kong. So it's because if you look at the PricewaterhouseCoopers healthcast, I mean, the business people always know what the issues are. Okay, they talk about that the current health system of nations around the world will be unsustainable if unchanged, over the next 15 years. It was written in 2005. By 2020, you know how much money, most of us are from the United States, you know how much money we spend in healthcare in the United States? You know how many percent GDP? 18, 19%. We are spending close to 3 trillion US dollars, okay? So we are borrowing money to support our current healthcare system. So it's because of sort of the cost that is going to bankrupt half of every family who basically, because right now the drugs are so expensive before the surgery and procedures, but right now some drugs are costing $3,000 to $5,000 a month. So this is a paper that I wrote for the WHO back in 2000, kind of talk about the need for a new healthcare model and for visionaries at every sector to come together to kind of promote a development of a new health model. So what I'm trying to do is to at least have more people who would join into this very important movement that is global trend. Because the 21st century is mainly related to acute diseases. And it actually, the Western model is so successful and saved so many people's lives that people used to live to 40, 50, 60 years old. Now they live to 80, 90 years old. So that's why the current model is ill-equipped to deal with what we are facing now. And so there's a need for a new model. And obviously the movement in terms of family practice, primary care, prevention, wellness projects. But unfortunately, the money has not shifted. Okay, the money is still used to save lives, which I think obviously is important. How do you rebalance it is really what I think is going to require ingenuity of people beyond people in medicine. So I'm going to say a few words about complementary alternative medicine and how Chinese medicine actually is regarded as a complementary alternative medicine, in contrast to biomedical medicine, Western medicine, which is really the dominant system throughout the world. So this is what I've learned over the years. What is health? I think health is not just bodily health. It's body, mind, soul, spirit. And obviously, without that aspect of attention to balance at that level, I think we would not be able to solve a lot of the problems, because the bodily ills would just keep coming back unless we address some of the root of the problem. So the goals of medicine is another thing that I have learned, is not just to help someone who is sick, but you want to try to prevent disease. You try to promote a maintenance of health. And obviously, we cannot solve all the problems, but I think care has always to be central to any health professionals' lives. And then avoidance of premature death. But most importantly, I think, is the pursuit of a peaceful death. And I think that the silent, mental program really kind of have people think about spiritual longevity, that the body can be still useful, but then you move to the next, phase of one's, life in a different medium. So what is complementary alternative medicine? Because that would be coming up, and obviously I said that Chinese medicine is a very comprehensive system that includes acupuncture. Next slide, please. Okay. That includes acupuncture, include like Qigong, Tai Chi. Tai Chi is a brand of Qigong. And diet, the Chinese diet, is a little different from the Western, dietary approach. There's overlap between the two systems, and we can talk about it in the afternoon. And then there's Chinese herbal medicine. There's a lot of concern about quality control and the interaction with drugs and so on. But again, it can be a very, very useful approach if it's used by the people who know how to put it together. And then obviously, I personally like massage, body work, and anywhere that you would like someone to massage the area for you, it's obviously the area where the body is, having a spasm, is stagnation. So most of you in the audience obviously are of, ethnic, Chinese origin, and that obviously it's a health system that is actually longer than, when the Great Wall was built. I believe that Chinese medicine will be one of the most important, if not the most important, contribution to the modern world from the Chinese civilization. And the medical model is basically a very systemic, holistic model. It's never separate the body and the mind, and that is because it's besides biochemical, physiological base, it's also energetically, related as well. So the goals of Chinese medicine is basically how to restore the balance, how to restore flow, and also get the bodies to have the reserve to maintain the flow and the balance. And that is a very important way for us to look at the whole system compared to Western medicine, which look at different body parts and different symptoms of diseases, and they're complementary. It's basically global and local type of integration. So in Chinese medicine, obviously I'm using a few minutes to just talk about some of the physical construct of Chinese medicine, but the important thing is that many different diseases in Western medicine can be grouped under patterns. We actually, in Western medicine, for those doctors in the audience, we actually have patterns too. We talk about the DIC. DIC is a pattern. The systemic inflammatory response syndrome is a pattern. Insulin resistance is a pattern. It's a pathophysiological pattern. So as long as you basically have this pattern, you can actually use different ways to restore the abnormal pattern. When you restore the abnormal pattern, then different diseases that seem to be different in different locations will get better. And that's the reason why we are so interested after learning about this, doing this for the last 20-some years at UCLA in our center, with so many different subspecialists referring to us. They are now trying to bring it to primary care. And then I will talk about what I mean by primary care. Okay. So prevention is important. Prevention from the beginning, before the babies were born. You can optimize the genetic makeup of the baby. Okay. You need to educate the kid before they go interact with the outside world. And so prevention is not just vaccination or disease detection. Prevention is really optimization of the system, okay? So we're just talking about just a person right now. But you need to talk about the environment, you need to talk about the social environment, the natural environment in terms of prevention. So I look at 1992 as a very, very important year because I was getting a little impatient about that I was not able to fulfill my dream. I was an internist, I'm a clinical pharmacologist, I published in New England Journal, I published in Science, typical type of journals, but I really want to basically try to build this health model by blending the best of Chinese and Western medicine. So I went to my chairman of medicine, who just became chairman, and I said, well, I really want to do something. I said, well, it's a recession at that time. I said, there's no money. I said, kids, seems like a good idea. Go do it. So basically, that's what I've done, is that I have launched the Center for East West Medicine with no money from the institution, And I raised the money and built something that now has 4 or 5 clinics, and we have been teaching medical students for the last 21 years. We'll talk more about it later on. But in this 1992 conference, which was in San Francisco, and I kind of tried to first introduce it to Chinese communities to kind of talk about the potential of blending Chinese and Western medicine to create something that would be not only be clinically useful, but also would be safe and also cost-effective and accessible. But we also would like to have the right type of research being done to demonstrate the value. So everyone has to have many people helping to deal with something very, very difficult. And I would say that, first of all, I get the inspiration of trying to practice good medicine, be a good physician, be a good scientist, be a good educator, without the influence from my mentor, Dean Malenkov, who built UCLA from 1963 as a young dean to 1985 when he retired. 22 years of dean, to bring UCLA to be a sort of a new medical school, to be a world-renowned medical institution. So I was fortunate enough to have him as my attending during my externship and also my internship, and he has an open policy, door policy for me to talk to him. So he has been my inspiration. He built UCLA from a new place to a world-renowned institution. So right now, my inspiration is to see what I can do to learn what the West, have taught us about health and disease through the platform of UCLA. At the same time, try to see what I can learn from what the Chinese diaspora and other type of investigators, physicians can learn, to teach us about the integrative approach by blending Chinese and Western to create something that would be better for us in solving difficult problems and make it affordable and accessible to people. So Dean Malenkov has been my inspiration. And there are many other people, obviously, that without them, this work would not have been possible. So the Center for East West Medicine was established in 1993 around December. It is really, I would say at that time, I'm lucky that my chairman let me do it. It was a revolution. It was thought to be quackery when you try to even refer a patient to see a acupuncturist or chiropractor as a Western-trained physician. But I just had to do it. So when I launched it, I focused not on just research on a particular disease or modality. I said I want to build a healthcare model that would be helpful for people, families, and societies. So don't have time to talk about what we have created, but I want to focus on the clinical model, which I hope is very useful, not just for the physicians, because it includes a lot of self-care. So I want to basically train more people so that they can learn how to help themselves. And for someone who's at home, you would be the health coach, the health navigator, and at the same time, who would participate in this work. So it's not just us at UCLA doing it. Obviously at UCLA there are also other centers doing different aspects of integrative medicine. But there's a consortium of integrative medicine centers throughout the United States, actually in different parts of the world. Harvard, UCSF, UCLA, Stanford, Mayo Clinic, Johns Hopkins, and so on and so forth, all doing this type of medicine, integrative medicine, that reaffirm the important relationship between patient and physician, and also use all type of clinical approaches. And it's person-centered. It's a systemic, holistic approach. And you leverage the body's ability to heal. And that, I think, is a very important component. Now, obviously, a lot of people would say, well, all this stuff is all placebo. Yes. the body basically ability to heal itself is the giant placebo. Your compassion is the best healing force. So we now have got 12, 13 board-certified internists and one family medicine physician, because we're based in the Department of Medicine, and they are dual trained. Some of them have dual degrees. They have Chinese medicine degrees. Other also, my own son is actually also a geriatrician, all throughout UCLA training. But then he would do also partly our fellowship. We have a 2-year fellowship for physicians after internal medicine and family medicine. And we have acupuncturists that we also have to work with them so that they know how to work with them, a kind of a team-based type of clinical approach. And we now have about 20-some thousand patient visits, and but most of the patients are referred by more than 500 specialists within UCLA. Most of them have failed Western medicine, so in a sense, we are basically the clinic of last resort at UCLA. So it has been my clinical laboratory to test out this model and see that this model can be used to help patients with different type of problems. And now I'm able to have some of my former trainees who are now leading different clinics. And so that's the reason why we really try to build the primary care type of health system model. So in general, I'm just talking about generality. In general, Western medicine zero in the organ, the tissue, the cell, the molecule. Chinese medicine, because it's an ancient system, it just look at the whole, look at the black box. But for centuries, they have been figuring out where's the imbalance of the body, where's the flow problem, why is the body not able to handle the flow, and the balance. So by combining the two, looking at using Western medicine, look at the local, and using like basically the trees, and use the Chinese medicine to look at the forest. We have a more comprehensive view of the problem at hand. It gives us more tools to solve problems. So there are different type of models of integrated medicine. Our model basically is trying to create a gourmet dinner with the best ingredients, because there are a lot of integrated medicine programs that I think are like international buffet. You have different options. It's difficult enough to integrate Western medicine, because just like your radiation oncology, you have medical oncology, you have surgical oncology, and right now I think that there's a need for a physician to integrate the care of the patient with cancer. That's one area that I will be talking about at the American Society of Clinical Oncology in Chicago in June, because the body has been so fragmented. There's so many, based on modality or based on organ, that we lose sight of the whole. So our model is attempt to have the best ingredient from Western medicine and Chinese medicine, and try to put together a system. No one person can do it. You need a system approach. So this is our framework. We use Western medicine, biomedicine for disease detection. Obviously, Chinese medicine can do that too. Particularly acute condition management, and also vital sign, stabilization. And we talk about the importance of balance, the importance of flow, the importance of spirit. And obviously, the body basically can heal. We take it for granted. If you take good care of your body with the health cultivation, you should be able to live vigorously, for many, many, many years. And we really want to go to the root of the problems. A lot of the root of the problems really is the patient's lifestyle, life history. Unless you go to that, you will be treating just a symptom, even Chinese medicine. Because I've seen Chinese medicine actually, particularly, nowadays has become so Western medicalized that they use Chinese medicine to treat a particular disease, rather than looking at the whole, system approach of Chinese medicine. So the clinical model basically is to get to know the person, try to figure out what they should do, what they should not do, teach them how to eat, how to exercise, make sure that they sleep well, make sure that they have good posture. We then use, and adjust their medications and their whatever supplement they may be taking. We use acupuncture light stimulation, and but most importantly, make sure that the patient would do their homework, at home, because coming to see you right now for our physicians, they have so little time. They give you 10, 15 minutes. The acupuncturists may spend a little bit more time, but again, unless that time is used to educate what they should do at home, it would not be a useful visit. So the question is that, well, how are you going to do it unless the health system kind of look at value-based care versus cost-based care? It would not, be a successful approach. Because many patients come to us with so many problems. If they have so many problems using the old medical model of research, trying to find a magic bullet to see if you can solve the problem. And even if they find something, the drug is so expensive that it's not affordable. So you need a whole new model. And I think we can go back not just to Chinese medicine, but to Sir William Osler, who is the father of modern medicine. He talked about the importance of knowing the patient, and then much, much more important to know what sort of a patient has a disease than the diseases in this patient. So I kind of already go over a little bit about our whole person approach, and we basically have been lucky that UCLA, by the time they work them up and treat them, they already done hopefully the appropriate diagnosis. We already know a lot of data, so we just go right to treatment in general. So our treatment include really mainly education. If someone just rely on coming to see us, it's not going to be able to work, because we are no magician. I think lifestyle basically is a very, very important component. Okay. So we teach people how to prevent problems, so that they know how to dress appropriately. There are so many people with colds, but they dress like without a neck cover, and what you get is a little chill in your neck, and you get tightness, and you get runny nose, you get sore throat, you get headache, and then they keep cough. If you know how to do it, 1 or 2 days, if you know how to take care of yourself, you can get over you don't need to take a lot of medications, whether east or west. So learn how to prevent at different stage. Obviously, Western medicine in general, as I said, is very useful in saving lives. And also now I think in palliative care. Palliative care is now interested in, hopefully not just using morphine, because there are better ways to help deal with patient symptoms. So for the whole journey of one's life, you can use both medicines to one's advantage. And most importantly, you yourself, whether you are a health professional or a non-health professional, you need to take care of yourself. And that's the part that I think we all know. Healthy lifestyles, most people would be able to live much longer. And how do you create a healthy lifestyle? And I will refer you to a website put together by the University of Minnesota. And first and foremost, to have a life purpose, have meaning in life. Okay, but then you really kind of talk about how to handle your emotions, how to optimize your environment, your social environment, your natural environment, and try to have the right sort of activities. And so that's important, because we all are facing stress in our lives. Some are avoidable, and some are not avoidable. And that's why what I teach my patients is that, well, avoid those that you can avoid. When you can avoid it, I'll teach you tools to allow you not to get the ill effects of the stress response on your body, which is in general inflammation. Inflammation, okay? Remember, inflammation is responsible, contribute to 80% of the chronic diseases. So you need to minimize inflammation. And how do you do that? Well, that's what we want to show you. We'll talk more about it. This is the scientific explanation why stress is so bad. And their stress is actually focusing on psychosocial stress, because a lot of people interested in this area are the psychiatrists, psychologists, but body-mind people that link the body-mind back together. But as I talked about before with the patient that we discussed, any stress, okay, and the body had trying to mount a response, and inflammation would be, lead to your tight neck and your tight back. And we'll talk about neck and back, why they are very important, and why posture is important. How many of you have had acupuncture? How many of you? Only a few. But I would say all of you have done acupuncture-like stimulation on yourself. Okay? Where do you put your hand when you have a headache? You put it on your temporal areas. You put it behind your neck. Sometimes you may even be massaging some parts of the body that you don't even know that they are acupuncture points. So each one of you, and I will teach you, some of you who come to our workshop, what acupuncture points you would use for your neck pain, headache. Okay? Go back. So there are misconceptions about acupuncture. There are a lot of research on acupuncture. For physicians, please do a Medline search, a PubMed. There are thousands of papers on basic science of acupuncture research or clinical research. There is also a lot of concern that, well, acupuncture is actually not better than placebo. I already talked about that the placebo response to your body's innate ability to heal. Acupuncture enhances it for those who are responders. Just think about surgery. A lot of people don't realize that, when you lance a boil, the body heals. And the wound healing is actually what I think acupuncture trying to elicit is a micro trauma type. And there are many, many explanations why acupuncture may work. Okay? And I think acupuncture is not just for pain. But if you know that we use acupuncture rather than morphine for pain, we would not have a opiate crisis right now. That we need $60 billion to deal with this crisis in bankrupt many cities. Okay? So at least by virtue of us providing this at UCLA for the last 20-some years, we have much less number of people who are relying on narcotic analgesics. And non-steroidals are good drugs when you have true inflammation, but you should not use non-steroidal anti-inflammatory agents for regular, pain. So Aleve, I take it occasionally too, Motrin, but those drugs, can also harm your stomach, your kidney, increase your blood pressure. But a lot of people don't know that there are many other non-drug approaches to take care of, problems that one may have. And all our patients, all our students, and during our conference, we teach people how to do acupressure for themselves. Okay, acupressure is just sort of a way, besides needle, to enhance the body to heal itself. Okay, and acupuncture is pretty safe. If you know, first of all, in general, it should be okay. Now, if you are pregnant, please do not massage, hagu, okay, which because it may induce labor. But in general, acupressure is very safe, and acupuncture is so safe that I think the acupuncturist malpractice insurance is less than $1,000. Okay, so there are different ways to stimulate the acupuncture points, and sometimes you can use just a TENS unit. Right now, you can even plug it into your cell phone and you stimulate some of the points. Okay, you don't need to use needles. Okay, you can put like your patches of Tiger Balm or Salon Pass, over the acupuncture points besides the painful areas. And then obviously we in the clinic also use trigger points where we use a tiny bit of lidocaine, but we don't use steroids, and it allows us to have a patient get immediate release because we are a Western, medical clinic. We are able to do the trigger point. In general, I use the trigger point for local problems. I use the acupuncture to treat the bodily problems. So that's part of our clinical model. And cupping, some of you would actually have seen Michael Phelps with his cupping. Cupping is actually another way of stimulating local acupuncture points, but you can do cupping up and down the paraspinal areas, but that's basically stimulating all the autonomic ganglions, in the body. A lot of research on acupuncture. I basically first looked into acupuncture back in 1970s. They used neurophysiology to study acupuncture analgesia, and then Professor Han Ji-sung, who's now 90 years old, from Beijing University, the Brain Research Institute. He's the one who studied, acupuncture related to endorphins, even before endorphins were discovered. And some of our colleagues have studied nitric oxide in terms of acupuncture, but our interest right now, I've done some of my own research with acupuncture, but right now I'm more into disseminating a safe, effective, affordable healthcare model. That's why so because acupuncture is really quite safe. And the NIH 20 years ago, suggested that the acupuncture may be useful for dental pain during dental surgery, for nausea, vomiting, and recommended as adjunctively for many pain conditions. But we use it for stress. We use it for insomnia. We use it for a lot of emotional issues, many GI complaints. But basically, patients come to us with many problems. I just use this model, and many of them, if they follow, many of the conditions would, be able to get better, and some of them, they don't need to take, their medications. You can actually also use to treat many autoimmune diseases as well, at least adjunctively, so that we can take some of them off their, biologic. So again, WHO also have some recommendations. Some of them may be based on clinical expertise, different level of evidence. The NIH one 20 years ago based on systemic review and RCT, type of meta-analysis type of evidence. But again, for something that's safe, that potentially may be useful, I think it's worth trying. So this is what we do in our clinic. We basically have people come to us with so many different problems. But if you make them sleep better, their pain, fatigue, their emotions better, many conditions get better. And when they take less medications, because each medication would lead to potential other complications. And I'm a clinical pharmacologist. I teach doctors for rational use of medications for many years. But I think that to teach them non-drug therapy. So if there are pharmacists in the audience, I would like to actually get pharmacists involved so that they become advisors for people how to use non-drug therapy versus drug therapy. And I think most importantly, learn how acupuncture can, and many of the other approaches like deep breathing, meditation, anything that improves the vagal tone. The vagal tone would help decrease the inflammation, okay? And which I said is, involved in 80% of chronic diseases. So Kevin Tracy published in Nature 2002 for the physicians, review his work. Okay, he was featured in New York Times. But he suggests something very invasive in stimulating the vagal nerve. I think that you can get a TENS unit and put it on your shoulder area, close to the base of the neck. It may potentially, and also in your back, which is really make sure that your adrenal, don't give them so many, prednisone, because it would keep the body, having to rely on, more and more of it. And so you want to be sure that you improve the body's ability to withstand, the stress that lead to the inflammation. The army is now using, this. All the medics, are taught ear acupuncture, because imagine you have, some of our soldiers who get their morphine, you have to carry them. But now when they give them, acupuncture on the field, they can walk around. So I already more or less give you an idea about what. So integrative medicine is a lot broader because people use different healing traditions. We try to use Chinese medicine, and even within Chinese medicine, we use diet versus like the herbal formulas because of our concern. We'll talk about, a little bit about herbal medicine, but we focus on the soft tissue, which is really a very important area in both Western and Chinese medicine, because the soft tissue is your muscle, your tendon, and in Chinese medicine, for the benefit of the people in the audience, in Chinese medicine is related to the gan and pi, okay? So that to me is very, very important before the body gets really seriously ill, when the nerve and also the bone get involved. So in our clinic, and I'm merging the two medicines. The important thing is the idea that soft tissues manifest as trigger points in Western medicine. And Janet Travell, she was the physician to John Kennedy, helped John Kennedy with his pain. So basically, the trigger point accounts for so many problems. Now, if you have bone and nerve problems, you always will have trigger points. If you have trigger points, some of them lead to pain, some of them lead to your nausea, your inability to think clearly, give you dizziness. We treat many dizziness patients because their neck is so tight, and you take care of that because it affects the vestibular system. We take care of our ENT problems, even ENT surgeons who fail 3 surgeries. So because you need to deal with the root of the problem, which is really their posture, their stress, and then the tight neck. How many of you have tight neck? Yeah. So come to our workshop in the afternoon. So basically, if someone is under stress in the hospital, it's such a stressful place. You get IV, you get all, and then you sleep in a bed, and the body is full of tight knots. Okay, the tight knots that you have are trigger points. Okay, so there are many, many factors that lead to that. So if you learn how to actually touch yourself each day, see where your knots are, make sure that, it will go away. Because many of you would know that when you have a Charlie horse, you cannot walk, okay? Then you know that you will massage it. But it will be in your neck, in your back, in your shoulder, in many areas. So just learn how to stretch. I think the stretch exercise was very good because so that's why Pilates or some yoga poses and Tai Chi, all the different exercises are ways for you to stretch so that the knots would not be formed, okay? Because when the knots are there, it basically would impede flow of fluid, flow of blood, okay? And at the same time, it generates heat, and then it becomes fibrose. So what we have learned actually what I've learned in the 70s is the overlap between acupuncture points and trigger points. So it's almost like if you tell me what problem you have, what symptoms you have, I already know exactly where you have those knots, okay? Because the acupuncture can be used to treat different conditions. Western medicine only would, the physiatrists and some neurologists and maybe some rheumatologists or pain specialists, they know how to do trigger points for pain. We use trigger points to treat many other conditions to extend the indications. So a few words about stress management. And I think pets are very important. And sense of humor. I think that, but I would suggest that crying is a very important healing that I think a lot of, I would say, women nowadays, they used to cry more. Now, at work, they you know, so to me, and then what happens is that you don't cry, you bottle up, your neck gets tight, you swallow your anger in. That's how you get, the heartburn and the esophageal spasm and I would say thyroid problems and so on and so forth. So very important. This is our normal response when we don't get what we want, we hurt, we cry. But go to do it in private. That's what I tell my patients. Okay, eating. Just a few words about eating. So we have a whole section in the afternoon about East-West. So UCLA has been moving in this field long time ago, and nutrition. But nutrition obviously is slowly getting into the curriculum of medical schools, and unfortunately, I mean, what you're talking about is the surgical and the medical drug treatment in the curriculum. So nutrition usually does not get, and I think that the nutrition type of education one gets would be usually in the TV ads. Okay, oftentimes you probably eat the wrong kind of foods rather than the right kind of foods. So, in general, Western medicine and Chinese medicine overlaps in terms of decreasing inflammation. There is an anti-inflammatory diet, and in Chinese medicine, there's also diet that would also decrease, heat. Too much heat. Heat is inflammation. Okay, so we usually use Chinese medicine to fine-tune for the person's constitution and pattern. Okay, so East meets West, and I wrote this article for Professor Xin in National Taiwan University. She heads up the program on nutrition. So just a few words about herbal medicine. I came to UCLA to study natural product chemistry because I want to get a new drug from the herbal pharmacopoeia. And but I kind of decided that maybe I would move better into medicine. Dou Youyou got a Nobel Prize, but I recognized her work in the 70s. I get to meet her in the World Congress in '97 in Beijing, and then I interview her. One of my projects, which I think is a very important project, is to interview pioneers of integrated medicine in the world. I started out with China and the U.S., and she basically, at that time was 2007. She talked up to me about her work, on Qinghao, and we translated our interview with her and put it on YouTube. And then by 2011, she got the Lasker Award, which is a precursor to the Nobel Prize. So she got the Nobel Prize in 2015. And but again, this is still Western medicine. This is still Western medicine using modern science and technology to get a new drug. Okay, but Chinese herbal medicine basically have their own systems of diagnosis of a pattern, which we would talk about a little bit in the afternoon. And you have to use that as a way to diagnose a patient, and then use the appropriate treatment. Okay, but you can use diet. There's so much, useful ingredients in your kitchen that you can use to take care of a lot of the health problems. So there are a lot of, I would say not a lot, there's beginning more and more research on demonstrating that Chinese herbal medicine for the flu is as good as Tamiflu. Okay, or another good friend of mine, Professor Zhang Yongqi. He's from also Taiwan, and he is doing research on a herbal formula for GI cancer support. And a lot of doctors, and I would suggest that you do not take herbs without telling your doctors about what you are taking. And I know that a lot of doctors will say, well, don't take it, otherwise don't come back to see me. Okay, but I think it'll be important for someone to help look at your health. That's why I want to dual train people in the health system to allow this to be used in a way that would be safe and effective. So Tai Chi, Qigong, meditation, all very, very useful. And I just have someone who is a top researcher in Boston who did most of the very important research on Tai Chi for fibromyalgia and also for patients with osteoarthritis of the knee. So I would encourage you to learn more about like the benefit of the body-mind exercises. So I think that a lot of us are already trying to integrate. For those of us in the U.S., we are in general bicultural. We have benefits of both. But how best for you to orchestrate it? That's the challenge. Otherwise, you'll be mixing it. So education is what we really have been working on, educating different level of people, because this is what our goal is, to have a better healthcare system. So for the last 20-some years, I first taught Western medicine and clinical pharmacology. The last 21 years, I've been, sharing what we have learned to many generations of our physicians and medical students. So we have done a lot of training programs, and at the same time, not just medical people. I have people who are MD, MBA, JD, MD, MPH, Doctor of Public Health, because we need the whole system to come together to transform the current health system. And we have been working with Shanghai, and I also have been in Taiwan a couple of times the last couple of years, and more or less to kind of talk about how at least the diaspora would take this work first, okay? But I'm also taking the work to the Middle East and also Europe as well, and South America. And but one of the projects that we have done is with Shanghai, and train primary care physicians and train the acupuncturists to practice good primary care. And so that's my primary care team. And obviously, Margaret Chan has been someone who tried to encourage me to go back to Hong Kong. But rather than for me to be in Hong Kong, I want to just base my work in Los Angeles so that I can work with different cities around the world. So that's my journey in integrative medicine. And Professor Yang Sibiao is probably the mentor for some of you who graduate from National Taiwan University. He is someone who brought me to Qiji actually 10, 12 years ago, but it has not worked together. But now I hope that we would collaborate more in the future. So the take-home message is that we need to have every sector to get involved. It's not just the medical profession, it's the policy, it's the finance, it's the education, the engineers, and so on and so forth. Every sector has to get involved in trying to transform the current healthcare system to someone that will be more socially responsible and also will be safe, effective, and also cost-effective for ourselves, for our children, for our grandchildren. Thank you very much. I think that's what I have to share with you.
Thank you again, Dr.
Okay, I'm very grateful Dr. Hui is willing to give a speech in regarding to integrated medicine. And in the future, I think we are going to try to collaborate with UCLA to develop some kind of combination of integrated medicine. So,
well,
thank you.
first of all, thank you for having me the chance to share what we have learned, but also to learn this morning from Dr. Lee. And secondly, I think very importantly, I want to take the work out of the ivory tower. I really would think that Chi is already do so many impactful work, and you have all the right ingredients with doctors who volunteer their time, you have acupuncturists, you have dentists, you have optometrists, you have many other health professionals and volunteers. And then I think if we in some way work together and build more or less a new health model, and through your kind of connections throughout, I think that we can really help more people. And that's basically what I would like to do with my remaining years in this earth.
Wonderful.
Help more people.
Yeah. Dr. Hui has a dream to create a new way in primary care system. So in the future, he's going to collaborate with us. Okay?
Okay.
Any questions so far? No? Okay.
Yep.
Okay.
Is trigger point the same as 原始点?
Well, what trigger point, some of them are related to tender points of fibromyalgia. They may be motor points in Western medicine, and it also in Chinese medicine is 阿西学会. Okay, so but then some of them are actually on the meridians of the classic acupuncture. So trigger point.
He referred 原始点 is some one doctor create a kind of way to treat the patient or help the patient. They call 原始点. Basically, it's tender point and also us.
Well, that's it. See, that's why they are all related. Okay, and I think that we can spend a lot of time to discuss this. Maybe we can discuss this more in the afternoon. But Dr. Lee, in the afternoon, Dr. Lee is from Beijing Hospital, and he's the vice chief of acupuncture and massage. So he will be, able to actually talk about that. We will discuss about acupressure points, acupuncture points. I think will be very helpful for health promotion. And so,
Okay.
Any other questions?
Yes.
My name is Dr. Han from New Jersey. I think that's no question that nowadays more and more Western medicine do involve the Chinese medicine now. I think there's 2 weeks or 3 weeks ago, there's a survey by one of the professors in Johns Hopkins. 15 primary physicians was surveyed and asked them, have you ever used Chinese medicine? Almost 1 in 5 of them do use Chinese medicine. Especially, I think 2 fields they feel that the best one is for chronic pain and the rehab. So they use the acupuncture for the pain and rehab. They even suggest that Tai Chi is the best treatment for balance for Parkinson's disease. Now, my number 2 comment is I think the Chinese medicine have 2 weaknesses. The first one, when you look at the so-called Chinese medicine doctor, I think they lack of skill of diagnosis. And number 2, in this country, in the Western medicine, they emphasize so-called evidence-based medicine. So the way the Chinese doctor use the herb, there's no scientific proof that that medicine works. However, if you do the scientific study, like I think that one of the 2015, one of the professor, I think Lu Yu, right, in Beijing, yeah, that's one. He's the one that used the herb to treat malaria. He get the Nobel Prize, awarded the Nobel Prize. So Chinese medicine did work, as long as they use a scientific proof. Now, my final question to the doctor. Now, you're talking about a trickle point. Now, in fibromyalgia, they have multiple triple joint. Now, do you have any patient or population in your treatment group have fibromyalgia?
We have, I would say, over the last 20-some years, thousands. So basically, no one knows how to take care of these type of patients. It comes to my, things that you can reverse fibromyalgia, you can actually prevent fibromyalgia. It's just that right now my work is so broad because we extend our work to beyond pain. Because when you take care of pain, you would be able to get people to sleep better, they would not be depressed, they would not be anxious, they would not be taking the narcotics, the NSAIDs, and get the steroid injections. You would be able to help, and then when they eat better, they exercise right, many of their other conditions can be better. So right now I'm very, very interested to just try to get the model to bring it to primary care so that, we will be able to, I start out with fibromyalgia and myofascial pain because I think that that's the part that Western medicine is, not, as successful. And I want to minimize the use of medications. And so right now, non-drug therapy would become a more important component of overall healthcare.
I have a question. Thank you, Dr. Hui, for your excellent, lecture for integrative medicine. We are from New York. Our New York team had doing so many medical outreach. We use, combine Western and Chinese medicine or acupuncture. It's a very successful integrated medicine. It's a patient are really appreciated for that kind of treatment modality. So my question here, regarding about insomnia and chronic sleep disorder, there's a lot of patients with this kind of problem. What's the role of integrated medicine and acupuncture on this, sleep disorder? And my second question is, you mentioned about the shark cartilage. So how will it help the human body health? Thank you.
Well, first of all, for the issue about insomnia, Dr. Cynthia Deep, in the afternoon, we have a section to address how this approach is used to treat sleep and also sleep apnea as well. But in terms of shark cartilage, we do not recommend it. Okay, that was part of in the 1990s, part of what people tried to use, but that's not, what we would like to recommend.
Okay, thank you.
So because of the time constraint, so I think, thank you, Dr. Hui, for your excellent presentation.
Thank you, Dr. Hui and Dr. K. So now I'd like to welcome back Dr. Richard Yang. He has some announcements.
Hello? Well, time went fast. Okay, right now it's going to be a lunchtime.